Hi everyone, I am Dr. Shahan and today in this video I will teach you about the different stages of venous insufficiency. This is very important. This is known as CEAP classification. CEAP classification is very important for your NEET PG, FMG and INSET examination. So if you are giving any of these examination like NEET PG, FMG or any other examination, please subscribe this channel. So basically you can see C0 doesn't has any change. C0 doesn't have any change. C1 means it has telangiectasia. What is telangiectasia? Spider veins. Spider veins. C1 means spider veins, thin veins. That is C1. C2 means when you make a 2 with your fingers, you make a V. Remember, you make a V. V for victory. Victory sign you make a 2 with your hand, with your fingers. In the same way, V actually means the varicose vein. Varicose vein. So C2 means varicose vein. So whenever C2 is there, remember it is varicose vein. How will you remember? Just remember that when you make a V or victory sign with your hand, you make 2. You make 2 fingers and that is 2 fingers victory sign VV for varicose vein. So C2 is actually the varicose vein. What is C3? Can you see the letter C? Letter 3. Basically the 3 actually is edema like swelling. 3 is edematous. 3 is swelled. Can you see 3 looks like is swelling. So that is why C3 actually is swelling. C3 is swelling. C4 means skin changes. 4 is the skin changes and 5 and 6 basically are the ulcers, venous ulcer, unhealed ulcers and healed ulcer and unhealed ulcer. I will discuss with the help of picture so that you can remember it. But now you remember C1 is the telangiectasia, spider veins. C2 remember 2 victory V means actually the varicose vein. C3 3 looks like a edema or a swelling, that is why 3 is edema, and C4 is the skin changes and 5 and 6 are ulcer. I will show you picture so that you can understand and remember it very easily. Let's read the CAP classification so that you can understand it better. Chronic venous insufficiency. These are for venous insufficiency scale and that is CEAP scale. C0 means there is no venous insufficiency, no signs of venous insufficiency. C0. 1 means telangiectasia, spider vein. 2 means V, varicose vein. C2 is the varicose vein. It was a question in NEET PG. So C2 was varicose vein. 2, remember victory V, how will make the sign, and that is varicose vein. C3 is edema, that is swelling. 3 is edematous and 4, I told you different skin changes. Now there are 2 types of 4A and 4B. 4A is actually eczema. 4A is pigmentation or eczema. 4B is lipodermatosclerosis, LDS. 4B is LDS. 4B is LDS. LDS is actually lipodermatosclerosis. It is a skin condition. LDS, lipodermatosclerosis. Don't worry, I will show you all these pictures. So don't worry. So C4 is 2 types, 4A and 4B. A is actually eczema. That is also a skin condition. And 4B, remember, specifically LDS, lipodermatosclerosis. Now 4C, you can remember or you cannot, but 4C is actually corona phlebectica. So C, 4C, from C you can remember C for corona. So corona phlebectica. Once again let us revise. C0 is nothing, no change. 1 means telangiectasia, small spider's vein. C2 is V, victory sign, remember varicose vein. C3, 3 looks like edematous, so edema. C4 are the skin changes. 4A is eczema. 4B is lipodermatosclerosis. 4C is corona and corona phlebectasia. 5 and 6 I told you ulcer, venous ulcer. 5 is healed ulcer and 6 is open ulcer. 6 is active active venous ulcer. Remember, 6 very important, that is active. It is active venous ulcer. And CA means asymptomatic and CS means symptomatic. CA means asymptomatic, CS means symptomatic. If there is symptom, CS. If there is no symptom, CA. So once again let us revise. C0 means no sign. Telangiectasia, once there was a question, C1. And varicose vein also question, C2. C3 edema, next time there may be a question. C4 A and B, remember carefully, A is eczema, B is LDS. And C, you remember, corona phlebitica. And 5 is the healed ulcer and 6 is active ulcer. CA is asymptomatic, CS is the symptomatic. Look at this picture. Let us correlate what we have studied in the last slide. C1 is basically the telangiectasia. Can you see? C1 is the telangiectasia. C2 varicose vein. I told you V, remember, varicose vein. C3, look at this, the leg is edematous, right side top corner, you can see edema, C3. C4 and 4, basically the skin changes. 4 you will get pigmentation, you will get eczema, and that is C4A. C4B is LDS, C4C is corona, remember. C5 and 6 are the ulcer. 5 is healed ulcer and 6, I told you to remember, that is the active ulcer, that is active ulcer. Once again, let us revise. C2. C2 is the varicose vein. Remember, 2. 2, you will make the sign with your hand. 2, and that is V, and that is varicose vein. Varicose vein. C3. 3 is edematous. So, edema. C3 means edema. Whenever there will be edema in the question, the answer will be C3. You have to remember C4B. Why you have to remember C4B? Because C4B is lipodermatosclerosis, and it has been already asked in questions for the NEET PG and FMG. So C4B is lipodermatosclerosis. What is C4A? Can you tell me? C4A is actually eczema. And C4B is LDS, remember, lipodermatosclerosis. Now, what is this LDS? LDS is basically chronic inflammation, fibrosis of the skin. When there is a chronic inflammation, fibrosis of the skin, that is C4B, lipodermatosclerosis, and it also happens along with atrophy blanche. So always remember C4A and B. C4A is pigmentation or eczema. C4A is eczema or pigmentation. There was a question recently, eczema was asked. Eczema is C4A. Do not confuse with C4B. C4B is LDS. This is C4B. Do not confuse with A. C4A is eczema, but B is actually LDS, that is lipodermatosclerosis. You can see lipodermatosclerosis, LDS. Once again, let us revise the CAP classification. C0 means there is no signs. C1 means telangiectasia or spider vein. C2 means varicose vein. C3 means edema. C4, A and B, both skin changes. 4A is actually eczema. C4B is lipodermatosclerosis, LDS. C5 is healed ulcer. And C6 is the active ulcer. So this CAP classification is very much important for your FMG, NEET, PG and INISET examination. Every year they ask you question regarding the same. So this is the end of this video. If you like this video, make a thumbs up and please subscribe this channel. Do not go without subscribing this channel. If you are new to my channel, please subscribe, because this channel contains so many medical videos. For your examination, it is very helpful for NEET PG, FMG and INISET. Thank you. Have a nice day. Bye-bye.